Hello. Today we're going to be talking about reinfection. I know a lot of people are hearing about that. And also we're going to talk about the test. There's the antibody test, and also there's the PCR test, that nasal swab test that everyone hates to get. So we want to bring a little bit more clarity about the test and about the immunity regarding COVID-19. So first of all, let's discriminate between the two tests. The PCR test is a test that we do. It's a nasal swab, and it lets us know about the acute infection. If someone has been infected or they're carrying positive COVID-19 viruses. And also, one of the things that test does that people don't typically ask about, it can tell you the viral load. And typically people don't ask, and the people that give you your results typically don't tell. And it's not something that they're trying to hide. It's just not information that has been given so far. But I would recommend and suggest that you ask about your viral load. How much viral load? That PCR test, the nasal swab, it can also tell you about the viral load, how much virus you have. The second test, the antibody test. The antibody test is a very strong and important test, because that test right there will tell you about your immunity, how your body responded to the virus, and have you mounted enough antibodies to protect you. And we want to know that as we move forward in terms of reinfection and also in terms of vaccine. Let's look at reinfection. Okay, now we know that there was one case, actually there's been 3 total now, but the first case of reinfection was in Hong Kong. And I don't want to get into the long details about the test, but the test was definitely 2 distinct COVID-19 viruses. This patient was infected in March and then again in August. The real interesting thing about this is that this patient had 2 different strains of COVID-19. And so there's some good things and there's some real challenging things there too. One of the most challenging things that this tells us is that this COVID-19 mutates. In other words, it can change its structure, and so the body doesn't recognize it as if, let's say that it was the COVID-19 that this person was infected with in March and it was the same one in August, the body would say, oh, no, you shut it down, bam. But the fact that it was a different strain brings on some questions in the minds of scientists and people that are trying to figure out vaccines and reinfection rates, etc. The second infection for this person was they did mount an antibody response, the antibody test, and they also showed that their symptoms were much milder than they were the first time. And that kind of goes along with infection, viral infections. Your body has kind of a memory of what has happened. And so it remembers, hey, I saw this before. We can do this. We'll shut it down. And so the symptoms that we're seeing, not only with the person in Hong Kong, the person in Belgium, and the person in Switzerland, the second time that they were reinfected, symptoms were much less, and they did respond to their infection by increasing their antibodies. And so what this tells us that, and it's 3 out of tens of millions of patients that we know of. This was actually a second infection of COVID-19. And again, I'll emphasize that it was a different strain. In other words, this COVID-19 can mutate into a different form. And so the body has to handle that different form in a different way. However, the body does remember that this is COVID-19, just in a different form. And so it's able to handle it a lot better. And again, as I mentioned, the symptoms that these people had were a lot mild, much more mild. We have influenza A out there, we have influenza B, we have the coronavirus. The common cold is a coronavirus. We have SARS-2 COVID, which is the COVID-19, and we have RSV, which is another cold that kids get. So we really have to do a lot of things, and some of those things I refer to as we have to eat healthy. We have to make sure that we're taking the appropriate vitamins, vitamin D, vitamin C, and other vitamins that your healthcare provider would recommend. We have to make sure that we're getting enough rest, exercise, social distancing, wearing our mask, washing our hands, because if we can get through this period of time between now and the beginning of the year, I believe that while the scientists are busy trying to come up with the vaccine, I believe that we will have made very great strides in terms of fighting or shutting down or bringing this COVID-19 to some reasonable end. And so if you like this video or this information, push the like button. If you want to know more, because there's so much more that I could talk about, but I don't want to hold you long. If you'd like to know more, if you have questions, push the like button or subscribe, and we'll talk about it. Thank you.